Streaming live now from Fox, bringing you all this live press conference from Washington, D.C. House leaders are holding a press conference on the Delta variant of COVID-19. It looks as though Representative Steve Scalise is speaking. Let's go ahead and listen in here on Live Now from Fox.
COVID. This is an evil virus. It's killed over 600,000 Americans, millions worldwide, and yet Speaker Pelosi refuses to hold a hearing on how this started. If we're ever going to be able to get through this, and especially to prevent something like this from happening again, we need to at least find out how it really did happen. And while Speaker Pelosi refuses to investigate this, many of us have taken action on our own to start digging into the facts, to try to get the facts as best we can. On the Select Subcommittee on the Coronavirus, all of the Republican members of that Select Subcommittee held a hearing on the origins of COVID. We brought in medical experts from around the country, and it was very, very eye-opening to see what they said. Every one of those medical doctors testified that the virus likely started in the Wuhan lab. They also testified that it is very likely gain-of-function research, not bat to animal to human transmission, that created this virus. Everybody in America ought to be concerned about those findings. But everybody in America also is demanding the same kind of answers we are. And the fact that the only person that won't investigate what really happened is Speaker Pelosi. What does Speaker Pelosi have to hide? Why is Speaker Pelosi actively fighting to get the facts out, fighting against it? Why is she trying to do the work of the Chinese Communist Party in covering this up? We know that the Chinese Communist Party won't release the background, the data, the facts, won't let us talk to those people that worked in that Wuhan lab. Was there American tax dollars that went directly or indirectly to the Wuhan lab to perform gain-of-function research? A lot of evidence indicates there was. All of these questions deserve answers. And we're going to continue fighting for those answers, even if Speaker Pelosi tries to participate in a colossal cover-up of the facts. That's what we're here to talk about. And to talk about it further, I'm proud to introduce our conference chair, Elise Stefanik.
Thank you so much, Whip Scalise. Just as a reminder, we were here with the Docs Caucus just 2 weeks ago. These members have been active throughout the COVID crisis, sharing their medical expertise, sharing their policy expertise. And I want to publicly thank the members of the Republican Docs Caucus for this leadership, these policy proposals, and this expertise throughout the crisis. From delivering vaccines to the American people, to their public service announcements encouraging vaccines, and of course their important work to follow the facts and the science to investigate the origins of COVID when Democrats have refused and failed to do so. I also want to take this moment to thank my local county public health officials and providers in my district who have worked hard to educate and answer questions and serve the public. Some of the most rural counties in New York's North Country have been nationally recognized for their leadership and vaccine rates throughout the pandemic. Americans across the country know we cannot afford another shutdown. We need to keep our schools and businesses open, and we must remain focused on getting answers as to the origins of this devastating global pandemic. Every American has been negatively impacted in some way by the COVID-19 virus. The question is, why are Democrats stonewalling our efforts to uncover the origin of the COVID virus? Why are Democrats not investigating the growing list of evidence that leads us directly to the Chinese Communist Party and their cover-up? And why is this administration refusing to hold China accountable? Our Republican members will continue to work to demand answers and accountability and transparency for the American people. And the GOP Docs Caucus is leading the way. And I'm proud to turn it over to one of the co-chairs of the Republican Docs Caucus, Dr. Andy Harris.
Thank you very much. Today, before we talk about the origins and where we go from here, let's just summarize a little bit about the Delta variant and the vaccines. Look, the Delta variant is with us to stay. We know that the vast majority of new cases in the United States are Delta variant. That's the bad news. It's a more transmissible variant. The good news is it looks like it's no more virulent. That in fact, if you look at deaths and hospitalizations, it's probably no worse than the original virus or the variants. Vaccinations, in a study just published yesterday in the New England Journal of Medicine, two-course series of vaccinations does protect against symptomatic infection from the Delta variant. So members of the Doc Caucus, like myself and others, have been vaccinating patients, have been participating in clinics, getting the message out that if you are at risk, you should be getting this vaccine. This vaccine does, in fact, protect against symptomatic Delta variant, and we continue to deliver that message. We urge all Americans to talk to their doctors about the risks of COVID, talk to their doctors about the benefits of getting vaccinated, and then come to a decision that's right for them about the vaccine. With that, I'm going to turn it over to Dr. Miller Meeks to talk a little bit more about the source.
Thank you, Dr. Harris. And thank you all for being here today. It has become increasingly clear, profoundly so after Republicans' hearing last month on the origins of COVID-19, that SARS-CoV-2 emanated from a laboratory leak at the Wuhan Institute of Virology. You know, criminals have been convicted on less circumstantial evidence than currently exists supporting a lab leak, and every day more evidence is revealed. What did the Chinese Communist Party know and when? Independent scientific studies concluded that the first cases of COVID in China occurred somewhere between mid-October to mid-November in 2019. Workers at the Wuhan Institute of Virology became ill with a respiratory infection at that same time, 3 of whom sought hospital care for a respiratory illness, which would now be considered COVID-like symptoms. Investigators from WIV and collaborators across the globe reported in 2015 Nature Medicine publication the creation of a new hybrid bat coronavirus that could bind to and infect human airway cells, proving that the lab was doing dangerous research on bat coronaviruses, including gain-of-function research, which could accentuate the ability of these viruses to cause pandemics. Both SARS-1 and MERS showed extensive human infection prior to developing human-to-human transmission, and none was found in 9,522 stored hospital records in Wuhan. No coronavirus in the subgenus SARS-CoV-2 had a furin cleavage site. There was no CGG joblet anywhere in the subgenus, and there is an absence of genetic diversity. All of this points to laboratory leak. We know it did not come from a wet market, which was the source of secondary spread. The World Health Organization investigation report failed to detect the presence of this virus after testing more than 80,000 wildlife, livestock, and poultry samples from 32 provinces in China. And remember, both SARS and MERS had an identified intermediate host. There were known laboratory leaks at this laboratory, as there are at other research laboratories. And bat coronavirus research and level 4 biosafety research was conducted in level 2 labs. The Wuhan Institute of Virology had been cited before for their lack of laboratory security. Despite this evidence, the World Health Organization perpetuated the myth that it could not come from a lab leak. The World Health Organization cannot be relied upon to do thorough, impartial, and an objective investigation. It perpetuated the lies of the Chinese Communist Party that there was no human-to-human transmission. It delayed labeling this as a pandemic, and that there was a potential for asymptomatic spread. Wu helped the Chinese Communist Party cover up the true nature and origins of the pandemic, which has caused the loss of millions of lives around the globe. Only recently has the World Health Organization finally relented and acknowledged that the lab leak theory is possible. But yesterday, the Chinese Communist Party still refuses to cooperate. At our hearing, Dr. Richard Mueller indicated that they have found no credible evidence that favors zoonotic origin. The origins of SARS-CoV-2 in the cover-up and its origins, both the cover-up and where it came from, they're important for a variety of reasons. It's important for public health, national security, and it's also important for how you in the media treat dissenting opinions, regardless from who they come. Those who talked about the origins of a lab leak were ridiculed and marginalized. In the public health arena, it's extremely important for the international community to set standards for the regulation of gain-of-function research and whether dangerous research can be conducted in these laboratories. Standards for biolab safety and breach of laboratory safety protocols or research done in adequate safety levels and repercussions if there's not immediate disclosure and transparency of potential viruses that could lead to a pandemic. This will better help pandemic preparedness in the future. And as discussed in our hearing last month, Chinese Communist Party has acknowledged doing bioweapons research, including gain-of-function research. This is a national security issue for us all. The delays in acknowledging the pandemic and the human-to-human transmission also allowed the Chinese Communist Party to stockpile PPE, swabs, and testing reagents that would be needed to protect the health and safety of people around the world, costing numerous lives. It's now my pleasure to introduce to you Dr. Greg Murphy.
Thank you, Dr. Miller-Meeks. Good morning, everyone. I think it's incumbent upon all of us here, especially you guys in the media, to understand that science is an objective issue. Not anybody in here in this crowd, I believe, checks a physician's credentials, whether they're Republican or Democrat, before they go see them and seek their advice. They sure don't, at least now anyway, look in medical school applications to see if you're a Republican or Democrat. This should not be a Republican-Democrat issue. And it's been made one by the Democratic Party, and honestly, it's been made one by the media. I'm honored to be part of this group, which is the GOP Doctors Caucus, and we would love to have Democratic physicians on this, but there's been no leadership from Speaker Pelosi on that side. We just truly don't understand what she's hiding. You know, as physicians, we stand trained to look at evidence when we diagnose a problem, and we draw fact-based conclusions. We're all in a unique position, actually, to dissect the origins of this pandemic so that we can prevent further health crises. It is obvious for anyone in the medical field that the genetic evidence at this point in time shows that this is a gain-of-function result from a gain-of-function, and possibly in part of Chinese bioweapons research. As we all know, there is clear and categorical evidence that leads us to believe that the COVID-19 virus started in the Wuhan lab. Despite what was pushed by the media, the evidence is overwhelming that this is what happened. It is up to doctors, scientists, legislators, public health experts to get to the bottom of what really happened in the Wuhan lab and hold those responsible accountable, whether they be in China, whether they be here in the United States, for their part in creating and spreading this virus. Last year, Republicans called for an investigation into the culpability of the Wuhan lab in the origins of COVID-19. Unfortunately, House Democrats quickly swept any notion of Chinese culpability under the rug, and big tech companies like Facebook prevented users from hypothesizing about gain-of-function research and genetic sequencing of this virus. I won't go into the genetic issues about this because all our eyes would glaze over with this, but let's just say when you put the pieces of a puzzle together and they fit, they fit. The Trump administration opened an investigation into the Wuhan lab despite left-wing criticism, but the inquiry, which we wonder why, was quickly canceled by the Biden administration. Again, why is the Biden administration being...
You're streaming live now from Fox. We will take a very quick 2-minute commercial break.
Any delay of an open investigation into the origins of COVID-19 makes it more difficult for Americans to get the facts and easier for China to bury the truth. No one will ever accuse the Chinese Communist Party of being transparent. We know for a fact that the Chinese Communist Party lied to the world in the early days of the pandemic. They must be held accountable not only by us, but by the entire world for the millions and millions of lives lost. When considering the facts behind the lab leak, let's look at the data. Medically speaking, the genetic fingerprint of the COVID-19 virus dispels any theory that the virus is naturally occurring. Scientists have found no evidence of a natural outbreak among bat populations, as was originally propagated by the Chinese lying Communist Party, or any other natural occurring organisms. Presence of a double GG sequence strain in the COVID-19 strain points to gain of function acceleration. Why Dr. Fauci is still dancing around this baffles all of our scientists. Recently, House Republicans on the Select Subcommittee held a hearing to discuss the origins of COVID-19. Those doctors and scientists came forward to testify that all of the available medical information on the table was there so that Americans can learn how this pandemic started, and they pointed exactly to gain of function and bioweapons research in the Chinese lab. We have an obligation of physicians, lawmakers, and Americans to demand accountability and transparency on behalf of the millions of families, not only in the U.S., but across the world, who have suffered unimaginable loss because of the COVID-19 virus. Thank you for being here. I yield back now to my esteemed colleague, Dr. Michael Burgess.
Thank you, and thanks everyone for being here this morning. I'm not going to add any more to the lengthy comments we've already heard, but we're happy to take your questions. Yes. We do have Dr. Marshall.
All right.
I beg your pardon. We always have to wait on the Senate.
Thanks, Mike. Yeah, we have anesthesia here, well ahead of us as well. But it is a great honor to stand here with the Doc Caucus. And as I look around, it's interesting. Every one of us have had a full career in medicine, and I think back to an oath that every one of us took, above all, to do no harm. And Whip Scalise, honorary Doc Caucus member. We're glad.
Slept at a Holiday Inn Express.
You slept at a Holiday Inn Express as well. We're glad that you're here, and I'd make a motion. We make Steve an honorary member of the Doc Caucus. All right. We'll send this unanimous consent here. You know, as we all know, the Delta variant is making its way across America. And the way I look at it is, if you haven't had the vaccine yet, this is a great opportunity for you to talk to your doctor about the pros and cons and the risks and benefits of taking the vaccine. On the other hand, I think we can all take a deep breath, a sigh of relief that the science shows us there's no reason to panic over the Delta variant. Here's the good news. Within 2 weeks, 2/3 of all American adults will have had both vaccinations. 90% of seniors will have had both vaccinations. And the people that are left that haven't had the vaccination, we probably think half of those have natural immunity. And I would also add, by the way, that for our children, probably 40% or more have had the vaccination as well. I want to reassure America that either natural immunity, having had the virus, or vaccination provide exceptional defense against the Delta variant, and all variants as far as we know. In fact, they probably prevent over 95% of hospitalizations due to the Delta variant. And I think that's what's important to be following right now, is the number of hospitalizations and deaths from the Delta variant, not necessarily just the number of people that are colonizing the virus right now. Look, the science has not changed, and the clinical picture of America looks better every day. This is not the time to close down schools. It's not the time to close down our economy or insist on mask mandates. This is the time to believe in the science, to work with the science, that our vaccines and natural immunity, that they actually work, that you should have confidence in them, that we don't need masks if you've had the vaccine or if you have natural immunity. We don't need to shut things down. That is not the thing that we should do. Look, as far as I know, not one child under the age of 18 has died from COVID unless they had some type of a serious health condition as well. On the other hand, we know that masks and closing schools without doubt is a cause of psychological and academic harm to our children. I believe and entrust our local school boards to make the right decision, not ordered by decree of politicians and bureaucrats here in Washington, D.C. Listen, this is not the time to panic. It's not the time for fear-mongering either. That doesn't do anybody any good. Science is not on the side of the fear-mongers. Here's the bottom line. If you haven't had the vaccine, or if you haven't tested positive for the virus, go to your doctor. Ask him for the antibody test, and then you and your doctor should decide the pros and cons, the risks and benefits, and if you want the vaccine. So thank you so much. I'm glad you all came out today, and we will try to answer some of your questions.
I think this gentleman here was going to be first.
Yep.
I was just going to ask, although, infection rates overall are not going up much higher, in pockets of this country with very large amounts of unvaccinated people, and many of them in very conservative parts of this country, hospitals are filling up fast right now. And I'm curious why you guys chose to make the emphasis of this press conference about the lab leak and not about stopping what is a resurgent virus right now.
You must not have been listening. I opened the conference.
You mentioned
I opened the doctors' part of this conference talking about the variant and vaccines, talking about the support of the vaccine by the Doctors Caucus, by the realistic approach to the variant that I think Dr. Marshall has talked about. So I'm not sure the point of your question. We did not choose not to discuss the variants in the vaccine. Yes, sir.
A quick question. Have you met with Dr. Moon and the Chinese whistleblowers who are very clear that it was a well-planned, they consider it an act of war, and had great need for especially the doctor that escaped from China?
So I can't speak for anyone else. I actually have. And all I can tell you is that the reason why we have to look so carefully at the origin of this virus is because this might not be the last virus that comes out of China. So again, in the short term, we make sure, as we have all said, if you're at high risk, if you're at risk for this disease, talk to your physician, get the vaccine. But as a country, we have to investigate the origin very, very carefully, very, very accurately, because this might not be the last virus that comes out of China. Yes, ma'am.
Last week, the Blue Dog Coalition sent a letter calling for a bipartisan investigation. Have you had any conversations with Democrats on this and working together on this?
Yeah, absolutely. So on the Senate side, we passed a unanimous resolution led by Senator Gillibrand and myself calling on the World Health Organization to do their job and investigate it. And then the Health Committee has actually started a bipartisan investigation.
And I did get a commitment from Diana to get the chairwoman of the Oversight and Investigation Subcommittee in Energy and Commerce a couple of weeks ago that they would hold a hearing on this. It has yet to materialize, but I'll take them at their word, and it was a good faith offer made, and we have to keep pushing. We can't. It is not going to spring voluntarily, apparently, and that is.
They're still working, and I think the White House and Senator Portman and them were working on a couple of things, and he was representing that. And the letter. I understand the letter's been signed by 11. So if they can get to a point, and we'll go from there. And that's what was asked about. Can you do that and present something?
Our April meeting, it was brought up that they were asking for an investigation, the Science and Technology Committee, and we've yet to see anything come forward. So you can ask the Democrats why they don't want an investigation, but the net result is we don't have an investigation. We had a hearing several weeks ago. Not one Democrat participated in that hearing. And as you've already heard, this is not just an American issue. This is a world issue. It is not a partisan issue. Everybody should be interested because there are serious ramifications if this was a lab leak, either accidental or intentional.
A significant portion of your members don't want to say whether or not they're vaccinated. Do you think that impacts the language that you're trying to put out there about the efficacy and the safety of the vaccine?
I would say not at all. Look, we believe in health privacy. The bottom line is we believe it. It doesn't stop at the COVID door. It's every citizen's right to choose to get a vaccine and then to choose not to reveal whether they've gotten a vaccine, just like it's your right not to reveal what medications you're on or what diagnoses you have.
And look at what we've done. 2 public service announcements that we have done. We have sent letters and to both the head of NIH, to the FDA, talking about vaccine, the separation of the vaccine, talking about using real-world evidence to go from emergency youth authorization to full authorization. I personally have given vaccines in all 24 counties in my district, and I think all of us have given vaccines. I spoke on the floor yesterday, again, about giving the vaccine and vaccine hesitancy. So I think we as members have been very vocal.
Yeah, I was just going to chime in and say I think that you as a press have a responsibility to ask questions of the Democrats as well. How many of the Democrats are willing to say whether or not they've been vaccinated? And what about the Texas delegation from the Texas House that came here? Well, they've said that, including the 6 that tested positive. Do we have any evidence of that? I highly doubt that those 6 people were all vaccinated and tested positive for this virus. So you guys need to hold their feet to the fire. Well, I'm just telling you, they were up here. They've already they stood right here and gave a brief, and they've spread it to the Speaker's office. They've spread it to the White House, and there's literally nothing coming from the mainstream media about that, and it's very hypocritical.
Do Republicans have responsibility to their voters to encourage people to get vaccinated?
Yeah, we all do. We all do. And look, down in my part of the world is probably the heart of Trump country. where's the best place to open a vaccine hub? A NASCAR racetrack. And we did, and it ran for months. And the vaccination rate was incredible. Now the hard part is getting that last mile of people who need vaccinations. And there are a variety of reasons why people haven't been vaccinated. And I think every one of us as a Doctors Caucus would suggest to the administration, if they would listen, that it's now time to go to single-dose vials administered in a doctor's office. You trust your doctor, talk to your doctor. You and your doctor come to the conclusion you need a vaccine. It can be administered there and then.
Let's go over here.
Senator, and the rest of the doctors, fully accepting the premise that the virus emerged in China and the Chinese government has been completely opaque about it. These vaccines are American-made by American companies, developed by American researchers with Western partners. Why shouldn't it be the patriotic duty of Americans to get this American vaccine and help the country?
I'm not sure I understand that question.
You know, a vaccine is a medicine, right? A vaccine is a medicine. Just like with any other medicine, there are side effects, and this is a personal decision. This is not a mandate. This should not come down from the government saying you have to have something, because there can be some side effects. Yes, we want people vaccinated. There's not one physician, there's not one doctor here that doesn't want people vaccinated. And I'll take umbrage at the fact that you guys are liking to point to people who are conservatives not getting this. I still practice medicine. And I have a doctor-patient relationship with one of those, which a government official knocking on your door is violating HIPAA. Is violating HIPAA by asking about vaccination status. And I will tell you, the patients that I see come from every race, every demographic, who have not been vaccinated. And that is their choice. That is their choice. So to point out and to say it's just not conservatives, it's not only disingenuous, it's a lie. But yes, it is our patriotic duty to care for other people, but it is also our patriotic duty to understand that we have individual rights in this country, and when it comes to medicine, that is a doctor-patient decision.
I follow up on the door-to-door because it's gotten so much attention and gotten so much blowback. The government goes door-to-door to deliver the mail, to take the census, to do all sorts of things. Why is it wrong to go and encourage people to get this vaccine?
Because it's a doctor-patient relationship when you're talking about medicine. It's not when you're delivering a piece of paper with a stamp. It's a doctor-patient relationship. That's why the house doctor, who is not my doctor, has no ability to ask whether I've been vaccinated or not. He does not have that relationship, which is a valued and precious relationship in this country.
Yes.
There's reporting this morning that the Biden administration is considering encouraging mask wearing for vaccinated individuals and unvaccinated individuals again nationwide in order to help curb this Delta variant. What's your reaction to that? And also on Capitol Hill, do you think that masking would help prevent the spread of the Delta variant?
Please convey to the president that's not a good idea. I'll be happy to speak to the Speaker of the House. Look, we've been down that road. What we do know now is, as Dr. Harris told us, people who've had the vaccination are very unlikely to have clinically significant disease, even from the Delta variant. I think until there is data showing that that is no longer operational, there should be no need to retrogress into a masked up Congress or a masked up state. We all need to make our own decisions. We all need to make our own decisions. And if you have in your community a prevalence and you don't feel it safe to go to your grocery store without a mask, by all means wear a mask. And let me just make a plug here. Wear a mask that works. Don't wear one of these damn cloth things that you all had on your faces. Get an N95 mask. They're now available. Get one that's made in America and make sure it's properly fitted and only use it for a short period of time and then discard it. Because what did we learn during the Ebola outbreaks? It was taking the masks on and putting them off that actually resulted in more transmissions.
Last question.
Yeah. Yes.
So I have heard somewhat more emphasis from Republicans on the importance of getting a vaccine. I'm wondering what changed for people that it felt important to emphasize that now.
We've been emphasizing it all along. I mean, the Doc Caucus have been emphasizing it all along. Let's take one more question. So you've been at one yes for a while.
When you were recently vaccinated or got your first dose this weekend, why did you wait so long? And have all the rest of you been vaccinated as well?
Well, first of all, I had done the antibody test months ago and tested positive for the antibodies. And so clearly that gives you protection. But with the Delta variant, I felt I wanted that extra level of protection. I've always been vocal, whether it was in the Select Subcommittee on Coronavirus, going back over a year ago where I talked about my confidence in the process of Operation Warp Speed, which President Trump initiated, and then improvements to the FDA. And look, there have been bipartisan legislation going back to the 21st Century Cures Act that did a number of things that laid the foundation for the FDA to be able to move forward in a quicker way on getting multiple vaccinations approved through their conditional use. And so I emphasize to people this wasn't rushed, because I do think there's some people that wonder if it came out in less than a year, which is a record in the history of the world. I think 4 years to go from new virus to vaccine was pretty much the record. To go in less than a year to get vaccinations, I do think it's important for us to let people know that process, because thousands of people were tested, and a new process by the FDA that we helped create with the 21st Century Cures Act, very bipartisan legislation, putting additional funding at NIH, putting additional reforms in the FDA's process so it won't take 10 years to do what could take months. And so the FDA followed those new abilities to bring safe drugs and effective drugs to the market quicker. And so all of that to say, we've expressed confidence in the safety and effectiveness of the vaccine. But again, as all of these doctors have talked about, ultimately, if anybody in America, I would encourage people to get the vaccine. I have high confidence in it. I got it myself, sent the pictures out. But also, if somebody has a hesitation, they ought to have that conversation with their doctor. Yep. And whatever that hesitation is, address it with their doctor and then ultimately make that decision, because it's a medical decision. But we ought to have the facts out there. And part of the fact process is to let people know that a new process was used. And the FDA is still the gold standard in the world for approval of vaccines. I know they're looking at trying to get a permanent approval by FDA, but in the meantime, the fact that the FDA was able to use new tools to get this to the market quicker shows us we need to be using that process for other life-saving vaccines, for cancer drugs, for ALS, Alzheimer's. That research is being done right now, and frankly, through Energy and Commerce Committee, a lot of other legislation where Republicans and Democrats came together years ago to put new tools in place so that we could get drugs to market quicker that are safe and effective.
Thank you.
Andy, can I
Thank
have
you
one more
very much.
comment? Hey, I just want to share with the press just for a second. This is a 3D print model of the COVID spike, and there's two very unique things about this particular spike. The protein spike is made of two units, an S1 and an S2 unit. Dr. Miller-Meeks was referring to these, but sometimes a model paints 1,000 words. The S1 subunit is the exact same subunit that was made in a North Carolina lab working with Dr. Shi in about 2014. That was used with viral gain of function research. And then the other unit, the S2 unit, is a protein spike that Dr. Baltimore, a Nobel laureate, said this is the smoking gun of why this was made in a lab. And that's the ferron cleavage site, the double arginine CGG codon that, again, that Dr. Miller-Meeks talked about. So it just looks like all roads would lead that this virus was not only leaked from that laboratory in Wuhan, but made there as well. And this is the proof.
Can you point to the CGG dimer?
It's this one right here. It's right here as well. So thanks, everybody.
Thank you all.
I like that.
See if I can code that guy.
There you go. There you go. Yeah, yeah.
You're streaming live now from Fox, taking a